occupation?
I work as a cashier in Pizza Bar.
So you're Russian, right?
Yes.
Did you marry?
Yes, I'm married with a husband and a daughter.
How old is your daughter?
My daughter is 10 years old.
Okay. So why do you come to me?
So I feel very pain and sometimes some heaviness in my abdomen region, and I keep vomiting, and the day before I measure my temperature and it's a bit high.
Okay, so we firstly talk about the pain. Where's the localizations of pain?
It's in my abdominal region.
Does it radiate to other place? Can you state the intensity out of 10?
Around 4.
Okay, what is the characteristics of the pain?
It's like aching type of pain. It's a down type of pain.
Is it throughout the day or it is like occasional?
Yes, it's very constant throughout the day.
When does it appear?
Sorry, 2 days ago.
2 days ago. So what is the frequency of the pain?
It keeps happening.
Okay. Does anything provoke the pain?
No, it just happened.
Okay. So just now you talk about vomiting. What is your frequency of vomiting?
Around 2 times per day.
What is your consistency of pain? The color of the vomitus?
It's yellow.
Yellowish vomitus?
Yes.
When does it appear?
Like 1 day ago, yesterday, it appears.
What is the provoking factors of the vomit?
I start to vomiting around like 1 to 2 hours after I eat.
Okay. And you say you have heaviness in the abdomen region. Which side does you feel like the heaviness is?
On the right side, around here.
So it's upper or?
Yes, upper.
Okay, so it's this region?
Yes.
Okay, so what is the intensity?
Around 4 out of 10.
When does it appear?
This one appeared earlier, like 1 week.
1 week ago. And is it like constant pain?
Oh yeah, it is constant.
What does it relieve the factor?
The pain will decrease a bit when I lie down on my right side.
Right side. Is anything provoking it?
I don't know.
You don't think so?
Yeah.
Okay. And you say you have fever. When does you measure your body temperature?
I measured last night, and the body temperature is 37.9.
What is exactly the time you measure your body temperature?
Around like after dinner, 9 p.m.
Okay. So when does it appear your fever?
Yesterday I felt like chills on me, and I was like cold sweating. That's why I measured.
So the fever only appeared yesterday night?
Yes.
Okay. Do you have loss of appetite?
Yes.
You eat very less?
Yes.
Do you have like weight loss?
Yes. Previously I was 77 kg like 1 week ago, but then yesterday when I measured it, I became 75.
75. So you have weight loss total of 2 kilograms. So patient, do you feel thirsty?
Yes.
Do you have any nausea?
Yes.
Do you have any headaches?
Headache a little bit.
Do you have any diarrhea?
Yes.
What is the color of the diarrhea?
The color is very pale.
Okay, pale color of diarrhea. How about your urine?
My urine is very dark color.
Dark color. What is the volume of urine? Is it a lot or just a little bit?
Urine, I think it's normal.
No. Do you have any like difficulties in urination?
No.
Do you have any difficulties in defecation?
No.
Do you have any any other symptoms like nose bleeding or anything? Nothing. So just only like pain in the abdomen region, vomit, fever, and also anorexia, weight loss, nausea, and diarrhea. Okay. And can you tell me what do you do like in the past 1 week or 1 month? Which special trips or special event you went for, and then you started feeling like that?
So 2 weeks ago at 15th of November, my family, we went for vacation in a sheep farm.
What is is only like sheep farm or any other animals?
There's also like dogs and pigs and cows.
Did you touch the sheep?
Yes.
Did you have like close contact with the sheep?
Yes.
Okay. Did you wash your hand after that?
I don't remember.
You don't remember. So did you eat something at the farm? Did you put something in your mouth?
Yes.
You put something in your mouth. And did you feel like discomfort at the day of trip? Did you feel like discomfort after the day of the trip? Like the next day?
The next day, no.
Not really. Is your parents, is your like husband and your daughter also like affecting?
No.
They are asymptomatic. They have no symptoms.
No.
Okay. So now I'm taking your past health history. Did you have any chronic diseases?
No.
Did your family have any diseases, past health diseases? Did you have any gastrointestinal disease?
Like gastric ulcer, peptic ulcer, gallstone, or any jaundice before?
Do you have any strokes or myocardial infarction? Did you undergo any past operations, especially in your abdomen? No. Did you have any trauma? Chest trauma, abdomen trauma, anything? Heat trauma? No. Do you have allergies?
No.
Allergies to medication? Allergy to anesthesia?
No.
Nothing. Did you have Did you have had tuberculosis before?
No.
Do you have diabetes mellitus?
No.
Do you have HIV?
No.
Hepatitis? Hepatitis A, B, C, D?
No.
No.
Not that I know.
Did you smoke?
No.
Did you drink alcohol?
No.
Did you take drugs?
No.
Okay, so do you have any medication history? Did you take any medications?
No.
Did you done a blood transfusion before? Okay, so for the summary, the patients have complaint pain localized in the abdomen region. It is not radiate, it is dull aching pain. The intensity is 4 out of 10 and is throughout of the whole day, and it appears 2 days ago, and it is constant pain, nothing provoke it and nothing relieve it. And the patients also vomit 1 to 2 times a day, yellowish vomitus, and it appears yesterday, which is 1 day ago, and it provokes 1 to 2 hours after eating. Patient is also having complaints of heaviness in the abdomen region. The localization is at the right hypochondrium region and it's not radiate, it's heavy. The intensity is 4 out of 10. It appears 1 week ago and is constant. The relieving factor is lying on the right side, which is the affected side. The patient is also having fever 1 day ago, which is yesterday, and the patient's measured body temperature at 9 p.m. The body temperature is 37.9 degrees Celsius. The additional complaints is anorexia, weight loss, 2 kg, nausea, diarrhea, color is pale, the urination color is dark, the volume is normal. Anamnesis morbid, the patients went to a sheep farm for family trip 2 weeks ago, which is 15th of November. There is other animals in the sheep farm, including dog, pigs, and goat. The patients having close contact with the sheep. The patient is having lunch in the farm, and we suspected that the patient did not wash her hand, and the patient does not feel discomfort on the day of trip and the next day of trip. The relative of patient does not have symptoms similar with her. After 2 weeks, the symptoms slowly appear, and the patient now come to doctor. For the past health history, the patient is not having chronic diseases, no gastrointestinal tract diseases, no history of stroke, no history of myocardial infarction, no past operation, no history of trauma on the abdomen, no past disease, no allergic to medication and local anesthesia, no tuberculosis, no diabetes mellitus, no HIV, no viral hepatitis, no smoking, no history of alcohol and drug abuse, there's no medicines history, the patient did not take any medication, and the history of blood transfusion is no. For the conclusion, the patient is healthy before this. There's no complications of gastrointestinal tract. The cause is more likely from the external environment. The elevations of body temperature indicate that it's either infections or systemic inflammatory response of patient. The patient is dehydrated as there is complaints of vomit, rising of temperature, diarrhea, and patient feels thirsty. Symptoms looks like food poisoning from bacteria or fungal origin, or it is parasitic infection. Patient is suspected to have gastrointestinal tract disease and problems of kidney. For the laboratory instrument, I will order complete blood count to see that the blood level and hematocrit, although the patient does not have any complaint such as nose bleeding and hemorrhagic in other parts of body. I will also want to know the electrolyte level of the patient as she is having vomiting and diarrhea for further fusion therapy. Moreover, I will also want to have laboratory results of hemostatic system to see whether there is a disorder for hemostatic, as the patient is having complaints of heaviness in the right hypochondrium region. Most likely is affecting the liver, although she has no complaints of nose bleeding and bruise in the body. As for the instrumental diagnosis, I will order a planned chest x-ray and for a liver ultrasound to scan where there's a hepatomegaly. That's all for my subjective examinations of parasitic infection.